Good afternoon. We have with us Dr. Parthasarathi Goswami, a neuroanesthetist and neurocritical care specialist from the Park Neuroscience Center, Kolkata. We welcome you to the Natco Farmers Specialty Studio this afternoon. And we look forward to listening to your advice to the younger generation doctors. Those are in the care of critical care and bacterial resistance treatments. How do you foresee the changes in the critical care management?
India being a country of 180 million people, I foresee in the next 5 years an explosive growth in the number of critical illnesses. The reason being, there is a disparity between the healthcare which is being provided at a standard level vis-a-vis the outreach of the people. So we are going to see a larger number of critical care units come up. Manpower is going to be very, very important, trained manpower, as well as a complete control about the pharmacology of the agents being used. Because unfortunately, due to the lack of regulatory control, what is happening is we are whipping the antibiotics to the maximum. And in the next 10 years, the next 15 years, with no new antibiotics being developed in the pipeline, I envisage that we are looking at an extremely dark situation, unless on behalf of the Indian Society of Critical Care Medicine and many other societies in which I represent, some concrete, discrete measures are taken by everyone to control, disseminate information about antibiotics, and rationalize their use. That's the way I look at it.
I like your term of whipping the antibiotics. I think that's something very strongly put. What is your advice to the young ICU doctors in patient care? How can they enhance it? What's the best thing you can?
I think we are, as a society and as many other societies would like to do, we would like everybody to follow standard treatment protocols, which are obviously not unmutable, but keep on changing over time. So every 5 years, we have a new set of protocols. Everything should be rationalized according to local data. So what is applicable in the West, in a hospital in Chicago, might not exactly be applicable to a hospital in Calcutta, or not to be applicable in Kozhikode. So having said that, you have to think locally, but act globally. So taking that into consideration, try to follow protocols as much as you can so that we can have standards of treatment which are equal everywhere across the land, whether it's the north, south, east, or the west, doesn't make a difference. That's number one. And second is try to change with the times by keeping up with the knowledge base. And that is exactly where companies like you or conferences like this will play an absolutely immense important role.
Thank you so much. My final question to you is: what is the prevalence of carbapenems in your practice? So, what are the treatment options you would look at?
Treatment options are very limited. The one thing which has obviously been in the news is the ceftazidime-avibactam combination, which we have used to a certain extent, particularly in different hospital-acquired neurocritical care patients. To some extent, I think we have had 10 patients till now in the last 6.5 months where we had to force to use this medication. But as far as carbapenemase resistance is concerned, it's a matter of great thought. I think about 20, 25, 30% will have carbapenemase resistant. And for detecting that, you actually need a fantastic clinical microbiologist who will form an essential part of any successful IGU team. Correct? So that's the way I look at it.
Dr. Goswami, thank you so much for your valuable insights and visiting our studio. We definitely look forward to it, and we wish you all the best.